So here is a visual mnemonic to remember the universal precautions against HIV. This is asked for 3 marks in your surgery paper. So first we'll go to the story here. Remember this story and you will be done with the all the memorizing points of universal precautions against HIV. So let's go to the story. See, this is an HIV patient. He is not shaved. He is undergoing a procedure which is requiring a lot of invasive surgery. But the surgeon has decided to go for a minimally invasive surgery, and while he is doing, he has got pricked, and he now went and getting his hands washed with soap water. And now we can see here the sister is preparing glutaraldehyde solution, and parents are watching the surgery, minimal invasive surgery, in outside of this chamber. There is a separate chamber for this HIV patient to be operated, and it is kind of foggy you can observe here. It is this form foggy you can remember fumigated. Now you can observe here there is a separate suction bottle half filled with the freshly prepared glutaraldehyde which the sister is preparing here, and we have a shelf which is labeled as handle with care, having a lot of needles and blades specialized with the label handle with care. Here we have fumigated chamber, and the surgeon is wearing disposable equipments like aprons. Like aprons he should be wearing, but he is not wearing here right now. You just remember over shoes, double gloves, and syringes, disposable syringes. So these are all disposable equipments. And then he has got cut immediate wash of accidental puncture. He is now washing here with the soap and water, you can remember. And these double gloves should be worn while doing surgeries or doing procedures on HIV patient. Any equipments should be incinerated. Here it is shown as incineration, and sodium hypochlorite solution should be used to clean the contaminated areas. This patient has got one accident kind of thing. Now when bringing him to the table, he has bled a lot, so that bleeding is now being cleaned with the sodium hypochlorite solution. Dilute the spilled body fluids with a glutaraldehyde. So this is the entire story. And when he got the cuts, he is being covered with a waterproof dressing. Now this is the story and associations with the entire scenario. He has got lot of beard and mustaches, because we avoid cleaning, we avoid shaving in the HIV kind patients before surgery. So this is the story. Now coming back to the theory, here you see the first point, care in handling the sharp objects like needles and blades. In this you can associate it with the picture where the shelf is kept and labeled as a handle with care. Care in handling sharp objects like needles and blades. All cuts and abrasions in the HIV patient should be covered with a waterproof dressing. Here you can see the waterproof dressing. Minimal parenteral injection. This can be remembered by this needle, but to make it more visual, I have kept the parents of this HIV patient waiting outside the separate chamber which is made for HIV patients. From parents, you can remember parenteral, minimal parenteral injections. Equipment and areas which are contaminated with secretions should be wiped with sodium hypochlorite solution or 2% glutaraldehyde. So they are wiping this with the sodium hypochlorite solution. Contaminated gloves and cotton should be incinerated. Contaminated gloves and cotton should be incinerated. Equipment should be disinfected with the glutaraldehyde. Here you can see the patient, the sister preparing glutaraldehyde to disinfect the equipments. Disposable equipments like drapes, scalpels should be used whenever possible. He is using the disposable equipments here. Walls and floors should be cleaned properly with the soap water. So these walls are there, no, whatever walls are there, they should be cleaned with the soap water. Separate operation theatre and staff to do surgeries to HIV patient. These are separate staff which are kept for HIV patient. This is the separate chamber that is kept for HIV patients. Avoid shaving whenever possible before surgery in HIV patient. Avoid shaving. All people inside the theatre should wear disposable gowns, plastic aprons, goggles, overshoes, and gloves. So he's not wearing the goggles, but just remember, I'll just put it here pictorially so that you can remember. He's wearing a goggle. Okay, so just imagine this as a goggle. Suction bottle should be half filled with freshly prepared glutaraldehyde solution. You can see the suction bottle being half filled with glutaraldehyde solution. Spilled body fluid should be diluted with glutaraldehyde. You can see here, spilled body fluid should be diluted with glutaraldehyde. Accidental puncture area in surgeon scrub nurse should be immediately washed with the soap and water. Here surgeon is washing with the soap and water. Theatre should be fumigated after surgery to HIV patients. Fumigation, you can see here the theatre is being fumigated. So this is the visual mnemonic that you can remember, so that you remember the universal precautions against HIV. One more time, let me just quickly walk you through, revise, 1 minute revision. These are the parents of the HIV patient who is watching the surgery, minimally invasive procedure. The patient is slept, and he is being avoided with the shaving, and cuts are being covered with the waterproof dressing. They are using disposable gloves and everything. Surgeon is wearing disposable equipments, aprons, goggles, overshoes, double gloves. All he is wearing. Still he has got pricked, and he is now washing with the soap and water thoroughly. And gloves and whatever the equipments, cottons are being incinerated here. Sodium hypochlorite is being used to clean these bleeding areas, blood areas. Whatever the body fluids are there, that are being diluted with a glutaraldehyde being used and prepared by the nurse to just disinfect the whatever the materials that are being used on HIV patient equipments. And glutaraldehyde being half filled in the suction bottle. We have fumigated the OT, and here we have a shelf which is labeled as a handle with care, which having needles and blades. So this is all the visual mnemonic for remembering the universal precautions against HIV.